After so many questions about all the different attachments, what they do, how to use them, how to use the gauze, contraindications, we're going to go through everything in this video, so sit tight. Let's talk contraindications first. What is a contraindication? A contraindication is something that would prevent you from using this product, using this tool basically. So if you are pregnant, if you have any kind of metal retainers or braces, if you have any facial piercings, you would want to take them out if you can. You should also be removing your jewelry. And yes, I did have my jewelry on in those videos. I do apologize for that. You should not be wearing jewelry when you use this. Jewelry is a conductor, so you may increase your risk of shock. High blood pressure, metal retainers, braces, pregnancy, cancer. If I am missing any, please let me know, but there are a few contraindications. I got a question about Botox. If you have fresh Botox, like you got it in the past 4-ish weeks, avoid that area. It can move the Botox around. Now for the different attachments and the gauze. So here is the gauze. This is woven. You can use non-woven or woven. This one is a little bit more airy. You don't have to use this one. You can use, like I said, the non-woven one. In terms of the zap method or sparking method, I don't like to use the gauze for that specifically. I'm going to show you what sparking is. You can use a couple of the other ones for sparking. I just like this one because of the shape and size. All right, I removed my jewelry. I want to show you guys what this looks like without the lights, because when you are using this with the lights on, you can't see the gases working inside the rod. So I want to show you what the argon gas looks like in here. All right, so here is what it looks like, and I'm not going to ground. I'm going to show you how strong this is. So this is the purpose of grounding, so that when you place it on your face, you don't shock yourself. I have a little friend up here on my forehead, so I'm going to turn it to about a level 2-ish. Remember, you're not going to start at a level 5. I'm going to ground, and I'm going to place it over the pimple and let go. Ground before you release. This is the tongue tube. This is going to be for targeting larger areas of your face. This is good for if you get any kind of dermatitis down on your chin, if you want to work in larger areas. I'm going to be using the gauze for this. You can get gauze that is shaped like a face mask, or you can get gauze like this. Ground, touch it to the area, and begin moving in circular motions around the area that I'm treating, and I would still ground before I lifted back up. You can also tie the gauze in a little knot at the bottom, or you can just hold the gauze and do it that way. I prefer to do it this way. I think it's a little bit easier. This is the one a lot of people were saying was intimidating to them. It's the one with the metal in here, the metal little spiral thingy. This is going to be for the deeper cystic acne pimples that are super deep under your skin. You can also use the sparking method with this. This is the mushroom head. It is filled with neon gas, so this is going to be more for anti-aging.